Let's talk a bit about dental implants, what they are, how they function, and how we choose different types of implant brands. An implant, in essence, is just a titanium screw that is placed in the bone. The whole history of dental implants is very long, and I won't go into the full details of it, but the most important thing that we need to know is that the earliest modern dental implants were placed by Professor Brennemark in 1965. They stayed integrated in the patient's mouth for over 40 years as of the last time it was checked, and they have very good long-term function. The reason implants work so well in the bone is because of a mechanism called osseointegration. In this mechanism, bone grows around titanium implants and anchors the implant firmly in the bone so that it is able to support other structures. Once an implant is integrated, it can be used to restore a whole host of different things. For example, if you're missing a single tooth, it can replace that single tooth. If you're missing a few teeth, a couple of implants can be used to form a bridge to hold all the missing teeth. If you're missing all your teeth, implants can also be used to restore a full arch in implant bridges or the more common all-on-4 kind of design. Sometimes implants can also be used for dentures if we want to use them just for the extra security so that the dentures don't move around when you're talking and eating. A less known function of implants is that they can be used for maxillofacial prosthetics. So patients, for example, who have lost a nose or a ear due to cancer, they're able to reconstruct that by placing implants in those surrounding bony structures and getting a prosthesis that can clip onto those implants. Patients often ask what brand of implant is best, and that's a perfectly reasonable question. The thing about modern implants is that all of them are probably going to integrate at approximately the same rate. They will be able to anchor in the bone, and the bone will form around the implants. So that part is quite well studied and quite well accepted. The important bit about the implant though is not so much about whether or not it sticks in the bone, it's about how we use that implant to restore and give you back the smile that you're looking for. So that's where a prosthodontist comes in. Prosthodontists specialize in restoring missing teeth and structures, and part of it involves the use of dental implants. It's important to note that implant parts are proprietary, meaning the parts for one brand would probably not be able to fit on another brand. As a prosthodontist, when I'm restoring an implant or picking an implant company, one of the things that I'm always looking for is how versatile the components are, whether they're able to help me restore all different kinds of situations, be it a single tooth or an implant over denture. Another feature I look for is how widely available the implant parts are. If it is a reputable company with a long history of success that operates in many countries, that's a good sign that the implant is probably going to be around for many years to come, hopefully for the lifetime of your implant as well. As much as it is nice to support small, local brands, implant dentistry is one of those areas where a bigger, more established company is often the safer bet. As a patient, it is in your interest to ask your surgeon or your prosthodontist what kind of implants they are planning to use to restore your teeth. Another important piece of information is how readily available these parts are, be it in the United States or overseas if you're planning to live abroad for a certain period of time. Finally, when you're done with implant treatment, it is always a good idea to get the brand, the diameter, the size of the implants that were used in your mouth, so that if you have to change provider, if you move to a different state, for example, you're able to continue following up with another prosthodontist for care, and we are able to find the correct components to restore your implants.